one of the consequences of the medical information explosion is that evidence-based medicine can't always answer every question that we have. And while we do have good ways to apply the evidence to clinical questions, and it should be applied whenever possible, and we have good tools to do that as well, there's also that kind of unknown area where evidence doesn't really answer the question, where somebody's private practice or anecdotal experience may be very valuable because there isn't any evidence to answer a question that you may be looking for the answer for. And that's where I see the real benefit and the beauty of some of the online collaboration tools and some of the features of Web 2.0, the ability to be able to blog, to discuss things with colleagues. There's sites like Osmosis out there right now, and video sites like this, Doctor's Channel, that enable physicians to share information between themselves and to rate it, comment on it, filter out the stuff that maybe doesn't make so much sense or that people don't agree with, and at the same time help to elevate the items that really have a good consensus, that maybe there's more than one person doing that, and seeing some synergy there. I also see some potential here for really getting the pulse of America's doctors by looking at things like smoking cessation guidelines that have just recently been released. The guidelines come from several years of taking a systematic approach of what is the best evidence out there. But what really is going to be important is how to make those guidelines translate into clinical care, and that's something that really there isn't a whole lot of evidence about it. So that's something that we can be discussing on these types of forums, and figuring out the best practices, figuring out the creative things and the innovative ideas. I heard about one practice where they had a prize of dinner for the nurse that asked the most patients whether or not they quit, whether or not they smoked or not. And that's the type of thing that doctors can take and put into practice, and that they can share through social networking sites. Where else are you going to find those little nuggets that can help us in our day-to-day practice?